Dr. Shweta Shah, a gynecologist, laparoscopic surgeon and director, Twameva Clinic, Mumbai. So today we are going to discuss how to assess the functionality of the fallopian tubes. Now, fallopian tubes are two structures which are present on either side of the uterus. The function of the fallopian tube is to allow the sperm and the egg to meet so that an embryo is formed, and this embryo is then transplanted into the uterine cavity. For the egg and the sperm to meet properly, the fallopian tubes should be open. If due to any reason, if the fallopian tubes are blocked, it causes difficulty for the sperm and the egg to meet, and this causes difficulty in conception. Now, the fallopian tubes can be assessed by three types of tests. One is known as an hysterosalpingography, the other is known as a sonosalpingography, and the third one is known as a diagnostic hysterolaparoscopy. Let us understand each of these procedures. Normal or healthy fallopian tubes can never be seen on ultrasound pelvis. It is only the diseased, infected or the blocked fallopian tubes that can be seen on the sonography. Now, either of the procedures to see the fallopian tubes are performed on day 7 to day 10 of her period cycle. Now, let us understand the first procedure, which is known as hysterosalpingography. Now, this was a primitive procedure when the other two methods of assessing the tube weren't available. Now, this is an X-ray, and because the woman is conscious, she is not given any kind of anesthesia. It is an extremely painful procedure for the women. Because we do some instrumentation below the cervix, it is richly supplied with nerves, and therefore it causes extreme pain while doing this procedure. Once we have finished the instrumentation, we inject a dye, and when this dye is then visualized through the X-ray machine, whether it is coming out from both the fallopian tubes. If it passes through both the fallopian tubes, then it is considered as open. Now, because it is a painful procedure, if the woman does not cooperate well during this procedure, even an open fallopian tube may be reported as a blocked one. And therefore, all HSD reports are given a value of about 60% only. The second procedure, which is known as a sonosalpingography, utilizes a sonography machine instead of the X-ray, the rest of the procedure remaining the same. Now, both of these procedures are done on an outpatient department, and it does not require admission. The last procedure, which is known as the diagnostic hysterolaparoscopy, is like a live relay of a woman's reproductive system. Now, in this procedure, the woman is admitted, she is taken inside the OT, given an anesthesia, and two telescopes are passed, one through her vaginal opening, which is known as hysteroscope, and another is passed through a cut made into the umbilicus, which is known as a laparoscope. Now, when the hysteroscope is passed, we assess the uterine cavity where the pregnancy is going to stay, and apart from this, we also see the internal openings of the fallopian tube. With the laparoscope, we see the external opening of the fallopian tube and also assess the uterus and the ovaries. Now, when we inject the dye through the vaginal end, we see that the entire dye is passed through the internal opening, through the tube and its external opening, and therefore this procedure is the most sensitive and specific procedure for evaluation of the tubal function. Another advantage of diagnostic hysterolaparoscopy is, apart from the tubal pathology, during the same procedure, we can address any ovarian issue, any uterine issue also. Once we have found out that either of the tube is blocked, we can also try opening of the tube because the woman is under anesthesia. This procedure of opening of the tube is known as tubal cannulation. For more such content on women health, kindly subscribe to my channel and do not forget to press the bell icon. Thank you.